Hello friends, today let's discuss on the topic causes of muscle weakness and its prevention, general principles of muscle strengthening. First, let's start with the introduction. Active movements of skeletal muscle is brought about by the contraction of voluntary muscles. This muscle tissue has contractile properties which are activated by nerve impulse to supply the effort required to move or stabilize the body lever. If resistance is applied to a muscle as it contracts, the muscle will adapt and become stronger over time. Adaptive changes can occur in muscles through the uses of therapeutic exercise if the metabolic capabilities of the muscles are progressively overloaded. Muscles which are contractile tissue become stronger as a result of hypertrophy of muscle fibers and as increase in the recruitment of motor units in the muscle. The cardiovascular response of the muscle improves, so thereby increasing muscle endurance and power. The therapeutic uses of resistance is an exercise program, whether applied manually or mechanically. It is an integral part of the patient plan of care when the ultimate goal is to improve strength, endurance, and overall physical function. All of us at some point in our life have experienced reduced power and tiredness bordering or fatigue. What causes this? This is a common complaint called muscle weakness. As the name suggests, it is a reduced strength in one or more muscles. Muscle weakness can be mild or severe, temporary or permanent, reversible or irreversible. Now here comes the causes of muscle weakness. The causes of muscle weakness may be because of: first one, metabolic diseases or disorders. Second one, brain and nerve diseases. Third one, muscle diseases. And fourth one is other diseases or conditions. The first one is metabolic disease or disorders. In this we have first one, Addison's disease. It is a disorder that occurs when the adrenal gland located at the top of the kidney do not produce enough hormones. And second one is hyperparathyroidism. When the parathyroid glands produce too much parathyroid hormone, the disorder is termed as hyperparathyroidism. And third one is thyrotoxicosis. It is a common disorder in women caused by sudden worsening of hyperthyroidism, that is, overactive of thyroid gland, symptoms occurring with infection or stress. The fourth one is low sodium or potassium level. Low sodium or potassium level in the body can also cause muscle weakness. And the second one is brain and nerve diseases. In this we have first one, cerebral palsy. Cerebral palsy is a brain and nervous system functioning disorder affecting movements, learning, hearing, seeing and thinking. And second one we have Guillain-Barré syndrome. Guillain-Barré syndrome is an autoimmune disorder in which the body immune system attacks especially the nerve covering called myelin sheath. Third one, Bell's palsy. This is a disorder which affects the nerve which control movement of muscles in the face. Damage to this nerve causes muscle weakness or paralysis in the face. And the fourth one is amyotrophic lateral sclerosis, also called Lou Gehrig disease. Amyotrophic lateral sclerosis affects the nerve cell in the brain and spinal cord that controls voluntary muscles movement. And fifth one is multiple sclerosis. Multiple sclerosis is a chronic progressive disorder in which the body immune system eats away the myelin sheath, that is the nerve cover. And sixth one is stroke. A stroke is a condition in which the blood flow to the brain is interrupted by a clot or because of a ruptured blood vessels. The seventh one is myocardial disease. People born with this type of metabolic muscle disorder are unable to produce an enzyme called phosphorylase that helps produce the energy required by the skeletal muscle for exercise. And here comes the eighth one, prolapse intervertebral discs. Sometimes pinched nerve due to slip discs in the spine causes muscle weakness. And the next one is muscle diseases. Myositis. Myositis or muscle inflammation involves groups of muscle diseases such as dermatomyositis, polymyositis, inclusion muscle myositis, and juvenile myositis. Dermatomyositis, which is a muscle inflammation with patchy, dusky, and red or purple skin rashes. Polymyositis, more common in women than in men, in which muscle weakness happens over days, weeks, or months and begins in the neck, hip, back, and shoulder muscles. And next is the inclusion muscle myositis, mostly occurring in men, in which the muscle weakness and shrinking is first observed in the thigh muscles, forearm muscles, and muscles below the knee. Juvenile myositis, occurring in children under the age of 18, and skin rashes is the first symptom. So here comes the muscle dystrophy. It is a group of inherited disorder that involves muscle weakness that get worse over time with subsequent muscle loss. Common muscle dystrophy includes: first one, Becker's muscle dystrophy. Becker's muscle dystrophy is a slowly progressive condition that affects only male and causes weakness and wastage of muscle. And the next one is Duchenne muscular dystrophy. Duchenne muscular dystrophy is a serious, quickly progressive neuromuscular condition caused by a lack of protein called dystrophin. And next one is myotonic dystrophy. Myotonic dystrophy is a condition that involves weakness and slowly progressive wasting of voluntary muscles in the face, neck, and lower arms and legs. And next one is other diseases and conditions. In first one we have poisoning, second one myasthenia gravis, third one anemia, and the fourth one is post-polio syndrome. So here comes the prevention of muscle weakness and muscle wasting. First one is in the flaccid paralysis. Muscles deprived of their motor nerve supply are limp, hypotonic, and unable to contract. Rapid wasting takes place and cannot be prevented, although it is thought that it can be arrested by improving the blood supply to the area by stimulating of the muscle fibers by electrical means. So here comes the principle of treatment during flaccid paralysis. First one, the affected muscle must be protected from prolonged overstretching by adequate support and sprints. Second one, the circulation to the area must be maintained to ensure adequate nutrition to the paralyzed muscle by the active exercise for other normal muscles in the area. And the third one, the range of movement in joint immobilized by the paralysis and extensibility of the affected muscles must be maintained by passive movements. Fourth one, remembrance of the pattern of movement must be stimulated and kept alive by passive movements while active movement is impossible. Fifth one, the strength and use of normal muscles in the area must be maintained by resisted exercise. And next one is in spastic paralysis. In spastic paralysis, muscles receive a motor nerve supply only by means of a spinal reflex. Since they are cut off from the higher center by lesion affecting the upper motor neuron lesion, those muscles are tense, hypertonic, and incapable of voluntary contraction or relaxation. This condition is known as spastic paralysis, or wasting is not marked. When a limb or segment of body is locked in spasm, circulation is impeded and muscles and joint contracture may develop over a period of time. The aim of treatment is to initiate movement to maintain normal joint range and muscle extensibility, and at the same time improve the circulation. Controlled sustained passive stretching also inhibits spasm sufficiently to permit movements. And next one is in primary lesion of the muscle tissue. In this case, loss of power cannot be arrested, although a temporary improvement often follows light exercise in cases which have not previously received treatment. And next one is in disuse atrophy. Provided there is no constitutional diseases, for example, rheumatoid diseases. Muscle atrophy from disuse can be prevented or controlled by strong and frequent contraction against resistance as wasting occurs, because an insufficient demand is met to elicit a strong enough contraction. So here comes the measure used to obtain initiation of contraction. The first one is warmth. The area affected must be warm, as moderate warmth improves the quality of contraction. Any methods designed to improve the circulation in the area is effective. For example, active exercise of unaffected muscle against strong resistance is a method of choice. And second one is stabilization. Stabilize the bones of origin of the affected muscles and join distal to those over which this muscle work improve their efficiency. Whenever possible, stabilization should be achieved by isometric contraction of strong synergic muscle working. Third one, grip or manual contact. The physiotherapist's hand gives pressure only in the direction of the movement to direct the patient effort and give sensory stimulations. The fourth one is stretch. Stimulation of the muscle spindle elicits reflex contraction of the muscle, provided the reflex arc is contact. Sharp but controlled stretching of the affected muscles at the limit of its extended range is followed immediately by the patient's maximum contraction. The fifth one is irradiation. In this we have, first one, the use of resistance to functional movement of the opposite limb, which normally produce fricative action on the other side, can assist initiation of contraction in the affected muscles. Second one, use of resistance to strong group which normally work with affected muscles also encourage contraction of the muscles. So here comes the goal and indication of resistance exercise. First one, to increase strength. Second one, to increase muscular endurance. And third one is to increase power. And next here comes general principle of muscle strengthening. Once the power of contraction has been regained, the muscle should be strengthened progressively until maximum function is obtained. Passive movements, support, and artificial methods of assisting the circulation are discontinued gradually and are replaced by active exercise. The general principle of muscle strengthening should be: first one, the affected muscle must be strengthened progressively by resisted exercise, which are specific for the group to which the muscle belongs. In this we have range. The range of movement is increased. Type of muscle work. Concentric, eccentric and static muscle work is elicited. Resistance. The resistance is increased by increasing the poundage of the resistance, increasing the leverage of the resistance. Speed. Increase or decrease in the speed of movement is progression for concentric work. Decrease in speed is a progression for eccentric work, and lengthening of contraction period is a progression for static holding. Duration. Increase in the number of times of an exercise performed or decrease is the rest period between each session of exercise, or a combination of both according to circumstance makes more work for the muscles. And second one, full range of the affected muscle as a member of a team of muscle which work to produce skill and coordinated movement must be restored by free activities, natural and skill movements. And the next one is types of exercise used to strengthen muscle and restore function. All active exercise maintains or increases muscle strength, providing intramuscular tension is increased sufficiently by demand of the resistance force. Weak muscles are provided with work suitable to their capacity by the use of assistant resisted free or resisted exercise, while objective, recreational or occupational activities ensure their return to functional use. In general, strengthening exercise are slow and precise. The techniques of strengthening exercise are: first one, assisted resisted exercise; second one, free exercise; third one, resisted exercise; fourth one, activities; and fifth one is assessment of progression. So here comes the first one, assisted resisted exercise. These are rarely used to strengthen muscles except in case of marked weakness when strength is insufficient to complete the range of movement. Assistance is provided in the weak range and resistance is given in the strong range of the muscles. And next one is free exercise. Free exercises are valuable as they can be practiced at regular and frequent intervals at home. Careful selection of the starting position and accurate teaching ensure the use of the muscles and grade the exercise to match their capacity for work. Third one is resisted exercise. Resisted exercise is any form of active exercise in which a dynamic or static muscular contraction is resisted by an outside force. The external force may be applied manually or mechanically. First one, manual resistance exercise. Manual resisted exercise is a type of active exercise in which the resistance is provided by a therapist or other health professionals. This technique is useful in early stages of an exercise program when the muscle to be strengthened is weak and can overcome only mild to moderate resistance. And the second one is mechanical resistance exercise. Mechanical resistance exercise is a form of active exercise in which resistance is applied through the use of equipment or mechanical apparatus. The amount of resistance can be measured quantitatively and progress over time. It is often used in specific resistance exercise regimen. And fourth one is activities. These are essential to ensure integrated action of muscle groups in the production of movement. They also restore confidence and general health. Fifth one is assessment of progression. Reassessment of the patient's abilities is made at frequent intervals to guide progression of activities and estimate progress. So here comes the precaution for strengthening exercise. The first one is Valsalva maneuver. It is an expiratory effort against closed glottis and must be avoided during resistance exercise. Second one, patient with a history of cardiovascular problem. And third one, patient with a history of abdominal surgery. Fourth one, fatigue, in which we have local muscle fatigue and general muscle fatigue. The first one, local muscle fatigue, diminished response of a muscles to a repetitive stimulus. And second one is general muscle fatigue. In this, diminished response of a person during prolonged physical activities such as walking or jogging. The fifth one is overwork or overtraining. The sixth one, substitute motion. Weak muscles work can be substituted by normal acting muscles. And seventh one, osteoporosis. And eighth one, exercise-induced muscle soreness. So here comes the conclusion of today's topic. Many factors such as disease, disuse, and immobilization may result in muscle weakness. The therapeutic use of resistance is an exercise program, whether applied mechanically or manually, is an integral part of patient's plan of care, when the ultimate goal is to improve strength, endurance, and overall function. Thank you.